Sister Warner. Prime Minister of Antigua and Barbuda, the Right Honorable Baldwin Spencer. You get that already?
No, no.
Oh, okay. So I guess we'll have to add that to the feature. Parliamentary Representative for St. John's Rural North, Honorable John McGinley. Honorable Ministers of Government and other parliamentarians. Ms. Reynolds, who is sitting in for the Permanent Secretary. I don't see the Chief Medical Officer. She's down here, Dr. Rhonda Seeley. Mrs. Eleanor Warner, Principal Nursing Officer, and Mistress Correlita. Am I right? Joseph, Superintendent of Public Health Nurses. And members of the Ministry of Health, Social Transformation, and Consumer Affairs. Invited guests, ladies and gentlemen, good morning. It is indeed a distinct honor and pleasure to be with you all at this groundbreaking ceremony for the construction of the Cedar Grove Clinic, another sign of the Ministries of Health commitment to ensuring the health and well-being of the people of Antigua and Barbuda. This event also signals the government of Antigua and Barbuda's commitment to primary health care that will be delivered to the people of this community. The representative of the constituency, the Honorable John McGinley, has been the driving force behind this project and has caused this historic occasion to come to pass today. And I say we should give the Honorable John McGinley a round of applause. Now, through the Cedar Grove Clinic, primary health care will continue to form an important part of Antigua and Barbuda's health care system. It will be the first level of contact of individuals and families from this community with our national health system, bringing health care as close as possible to where they live and work. Primary health care constitutes the first element of continuing health care process and is a mechanism to achieve health for all. The government of Antigua and Barbuda has provided for and continues to achieve this goal of health for all citizens and residents of Antigua and Barbuda, and by providing primary care services in our network of 26 community health clinics and health centers throughout the island. And ladies and gentlemen, the next clinic that is to be opened and to be given priority in its completion is the St. George's Clinic. I was asked to make sure I remind the audience of that. And the representative, the Honorable Dr. Jackie Quinley Andrew, has been a thorn in my flesh to do something about it. And surely, in hearing my voice this morning, I'm hoping that the people of St. George will understand the type of representative that they have. The primary health care delivery relies on health workers, including physicians, nurses, midwives, auxiliaries and community health aides, family nurse practitioners who work as health care team and to respond to the express health needs for the community. I would like to take this opportunity to say a special thank you to all those persons who work in the community health services in Antigua and Barbuda and who continuously show that the interests and the health of patients and the community are your main priority. I urge you to continue your good work. The Ministry of Health recognizes your efforts, and this new building represents the government's interest in improving your working condition, which will serve to boost your morale and productivity, and ultimately improve the quality of health care for all citizens of Antigua and Barbuda. Although it can be said that countries around the world adopt the primary health care approach in 1978, We are proud to claim that it has been recorded that it actually developed in Antigua and Barbuda as early as in the 1930s. With the inauguration of four-day nurseries and creches, the government has continued throughout the years to provide primary health care to the public with the establishment and maintenance of several community clinics, and the construction of Cedar Grove Clinic is a part of the Ministry of Health's program that is aimed at systematic revitalization of healthcare facilities. It has been realized that over and above the rehabilitation and upgrading of facilities themselves, a fully integrated approach is needed to provide equitable and sustained health service to everyone. To only build a new structure while ignoring other factors such as equipment and personnel will not enable us to meet the level of quality of care that we want to provide for our people. The Ministry of Health is very serious about planning and implementing health services in such a way that every individual, even in rural areas, have equitable access to the health services. In Antigua and Barbuda, we can boast of progress in infant and child mortality, where our rates are 15.7% and 18.5% respectively. Life expectancy at birth has improved, and we have 99% coverage for most vaccine-preventable diseases. We know that services provided at this clinic will help in maintaining and even improving these health indicators. These services include antenatal and postnatal clinics, child health clinics including immunization and medical clinics. I wish to take this opportunity to thank the members of staff at the Ministry of Health who have worked with other ministries in bringing this project to fruition. Special gratitude is extended to the Medical Benefit Scheme, who continues to support the Ministry of Health in primary health care. In conclusion, I wish to challenge the residents of Cedar Grove community to claim ownership of this facility and assist in its maintenance and protection. Treat it as you would treat your own, because ensuring the viability and survival of this clinic, you will be making an investment in your own health well-being. There is an old Arab proverb that states, "He who has health has hope, and he who has hope has everything." By constructing this health center, the Ministry of Health, Social Transformation and Consumer Affairs offers you health, hope, and by extension, the ministry therefore offers you everything. Thank you very much.